Hi, everybody, and welcome to another episode of MedTalk produced by Medical Tourism. And I'm speaking here with Dr. Ricardo García La Peña, cardiologist who has his practice in Monterrey with over 7 years of experience. And personally, he has helped me with a lot of conditions that I had. Hi, Dr. Garcia. How are you?
Hello, Gord. I'm so happy to be here with you again. The second time that I am here with you, so I'm very pleased.
Thank you so much for joining us. Don't forget to see the full interview in Spanish. I'll leave some subtitles for you guys so you can catch along. We're having a full episode speaking about the importance of cholesterol and how it can affect the heart. First of all, at what age is suggested for me to get my annual heart checkup?
I recommend that you start your first checkup at 30 years old. But if you have a family background of heart diseases, early age, and by early age is any heart attack, or if your parents died before the age of 60 years old, I suggest that your first checkup start as early as 20 years old, because by that we have the opportunity to identify your cardiovascular risk factors and change them over time so we can prevent heart disease in early ages.
If I want to do those studies in Monterrey, how many days do I have to stay there? Do I need to make an appointment online first, or can I just walk in? What's the protocol?
The protocol that we have in our center is that you make an appointment, and the moment you make an appointment, you're going to receive all the information about preparation, all that you have to know to be prepared for your checkup. In these checkups, we're going to run some lab tests, some other studies like treadmill test, ultrasound of other parts of your body like carotid, heart, aortic, because with that information, we can establish your risk of heart disease or cardiovascular disease. So be prepared to be here in Mexico 2 days. It's the recommended. Actually, the most of the checkups are done in one day, but we always recommend 2 days. So if we find something that needs further research, well, we have the time or the schedule to do those tests to you.
On the episode, you talk about the importance of checking out the lipid panel. With that annual checkup, does it include the advanced lipid panel, or do I have to ask it in advance so I can have a better idea of how my system is working and what type of cholesterol should I be looking out for?
Yeah, this is a great question because usual or a routinary lipid panel is not enough for knowing your cardiovascular risk. The advanced lipid panel, it's a very important test because it tells us not only the amount of cholesterol or lipoprotein like LDL, HDL, and triglycerides, but also tell us the size of the molecules of those lipoproteins. And not only this, we can have the lipoprotein insulin resistance index with this advanced lipid panel. And this is very important because we have to shift the paradigm of thinking that the problem is only in the cholesterol. And it's not that way. The real problem is in the metabolic syndrome that leads to higher levels of bad LDL or low quality LDL. I think that's the best form of describe it because the problem is not high LDL. The problem is low quality high LDL. And this low quality high LDL, it's a result of a metabolic problem that it's the background of that. So with an advanced lipid panel, we can assess all the background, the metabolic background that leads to high low quality LDL. So it's very important. So when you come here to do the annual checkup or your cardiovascular checkup, we can run the advanced lipid panel here with us. It usually takes about 7 days to be ready, the results. And then we can discuss it in a video consult 7 or 8 days later. With that information, so we can discuss your specific risk factors, your cardiovascular risk factors, and take action to reduce those risks.
Do I need any special preparation prior to my testing, like special diet or like anything, or just if I had a Big Mac and then I go there, no problem with the results?
So this is a very common question, but in reality, you don't need a specific preparation to do a cardiovascular checkup. What you need is that you decide to do it. It's the most important thing to schedule and make the appointment. And if you want to be a little bit more detailed, but you need to bring exercise clothes. So be prepared to do a treadmill test. And in regards the diet, so we usually recommend to avoid heavy meals like 2 days prior, because part of the checkup usually includes doing a little bit of exercise. So that's the only thing.
And personally, I've been to Monterrey to Dr. Ricardo's clinic, and to be honest, the technology there is, in my opinion, up to date. I think you guys are very competitive worldwide.
Yeah, and this is a very frequent concern of patients that come here abroad, and they ask if we have all the technology or how do we compare to other places in the world. But we are very lucky that here in our hospital, we have the same technology that the biggest centers in the US. But the best thing of all is that our cost or the prices of the studies are much lower than in other parts of the US or the most parts of the US. And we're talking about the CT scans, the MRIs, all of the diagnostic procedures are much cheaper than in the US with the same technology, with the same quality. Also, all the procedures like angioplasty, TAVR, all the advanced and very advanced procedures that we can do here are the same that in the US, but a very lower cost than there. So we're very lucky about that.
No, I think we're very lucky to have Mexico so close that we can go and do that at more affordable prices. Talking from experience.
I don't know about 30 or 40 years ago, maybe there was a gap in technology, but today there's no difference. We have the same technology than in the US, and we have the same preparation and the same the development of the cardiovascular medicine in Mexico. It's as good as any other center in the US or in the world. So we're very proud of it, and I think the Mexican people and the U.S. people can take advantage of this lower cost here in Mexico, and especially here in Monterrey, that we are very near. We are very close neighbors. Whenever you are in the south of the U.S., it's one flight away here, Monterrey. So we're very lucky.
Thank you, Doctor, so much for your time. And thank you all for listening. Don't forget to check the full interview in Spanish, where we talk about the importance of cholesterol and how it has impact our heart health. So I'm going to leave the link with another episode that I did with Dr. Ricardo. So we talk about what's the importance of visiting a cardiologist and the tests they do and everything regarding cardiology. So if you're not very familiar with the subject, we're going to leave the link below. Thank you so much for listening. And thank you so much, Dr. Ricardo.
Thank you, Gard. So nice to be here with you again.